Good afternoon, everyone. Welcome to the Hidalgo County Wellness Program 2021 Virtual Wellness Fair. My name is Diana Hualpa with the Hidalgo County Wellness Program, and I'm very glad that you joined us today. I hope everybody had a good lunch and is ready to learn more information regarding health and wellness. And in this presentation, we're going to be talking about suicide prevention. But before we get started, I want to make sure that technology is working for us today. So if you can see the slides clearly and if you can hear my voice clearly, please click on the raise hand icon that is located at the bottom of our Zoom webinar software. Again, if you can see my slides clearly and if you can hear my voice clearly, please click on the raise hand icon that is part of our Zoom webinar software. Thank you so much. It looks like we're good to go technology-wise. I do have a few reminders before we get started. Reminder number one is that we still have 2 additional presentations as part of our 2021 Virtual Wellness Fair. And we have a numerous amount of presentations that are now available on demand. Therefore, if you haven't registered or you haven't watched them, I do encourage you to go back to the auditorium and take a look at those presentations that we have already hosted. Additionally, the second reminder is that you are on listening only mode. However, you can submit your questions via the Q&A forum on our Zoom webinar software throughout the presentation, and we will answer them during our Q&A session. At this point, I do have the pleasure of introducing our guest speaker for today's presentation, Ms. Melissa Gallegos. Melissa is a graduate from the University of Texas Pan American. She received a Master of Education in Counseling and Guidance. She serves as the Mental Health Director of the Hidalgo County Head Start Program, where she serves 3,600 children and their families in the area of mental health services, consultation, and referrals. She also supports classroom staff with strategies that help support children with challenging behaviors. Ms. Gallegos enjoys spending time with her family and is passionate about serving the community. Melissa, thank you so much for being here with us this afternoon. Okay, where it looks like we may have a couple of, perfect. We are able to see your screen and we just need to make sure that you are on mute, Melissa.
Yes, there we go. Can you see my presentation, Diana?
Yes, we can.
Okay, perfect. Well, thank you. Thank you, Diana, for introducing me, and thank you everyone for being part of our wellness virtual fair this year. So today, what I have for everyone, we're going to be talking about suicide prevention. Like Ms. Diana said, my name is Melissa Gallegos, and I am the mental health director here at the Hidalgo County Head Start program. And we want to make sure that we talk and that we're aware of suicide prevention and what it is, what are some of the things to be on the lookout, what are some of the things that we can do when we know of someone that is going through something, and how we can help, and more than anything, intervene, right? Intervention, prevention is all about what we want to make everyone aware of. So we know that when we talk about suicide and prevention, we know that recently, not only recently, but this has really become just a public health problem that can have not only lasting effects on individuals and families, but also on our communities. So we know that there's a lot of factors that contribute to suicide, but one of our goals that we really want to focus on is on suicide prevention. We want to make sure that we reduce those factors that increase the risk, and also increase those factors because we want to make sure that we promote resilience. So this has become, suicide has become even more so after what we are going through with the pandemic and everything. It has become a public health concern. And as I was preparing for this presentation, I came across some statistics. And just alone in 2019, suicide was the 10th leading cause of death overall in the United States. So that's claiming a little bit over 47,500 people. This was back in 2019. I'm sure those numbers have changed now with with the pandemic and everything that we're going through. So I have a presentation that I put together, and we want to make sure that we know when we talk about suicide, what exactly is it that we're looking for? Let me see if I can change. So what is suicide? So we want to make sure that when we talk about suicide, that we know the difference between suicide and a suicide attempt. Okay, so suicide is when people harm themselves with the goal of ending their life, and they, of course, die as a result. When we talk about suicide attempt, that's when people harm themselves with the goal of ending their life, but they do not die as a result of their actions. So they attempted, but they weren't successful at it, right? So there's a difference. And we want to make sure that when we talk or when we refer to this, we want to make sure that we avoid using terms such as committing suicide or successful suicide or a failed attempt or a failed suicide. We want to make sure that we stay away from these terms only because they can carry for some like negative meanings. Just some facts about suicide. What we do know is that suicide is a leading cause of death. Okay, and some of this information I got according from to the Center for Disease Control and Prevention. We know that many factors increase to the risk for suicide or protect against it. Suicide is connected to other forms of injury and violence. For example, people who have experienced violence, including child abuse, bullying, or sexual violence, they have a higher risk for suicide. So it's really important that people, they stay connected not only to family, but to that they seek community support and that they have easy access to healthcare, so that we can decrease those behaviors, those thoughts, and that we can really take action and we can really get them the help that they need. The second one is suicide is a large and growing public health problem, like I mentioned at the beginning. We know that suicide rates have increased 33%, but this is according back to research from 2019, and I'm sure that those numbers have gone up. Suicide is the 10th leading cause of death in the United States, and it was responsible for more than 47,500 deaths in 2019, which is about one death every 11 minutes. The number of people who think or attempt suicide, I'm sorry, I moved that, who attempt suicide is even higher. In 2019, 12 million Americans or American adults seriously thought about suicide, and 3.5 million planned a suicide attempt, and 1.4 million attempted suicide. So we know that suicide also affects all ages. It is the second leading cause of death for people of ages 10 to 34 years of age, and it is the fourth leading cause among people ages 35 to 44, and the fifth leading cause among people ages 45 to 54. So just something that we really want to make sure that we're aware of, and that it is becoming a problem, and that it is out there and it is real. And we want to make sure that we are doing what we can so that we can assist our family members or friends that we know of. The third bullet is suicide has far-reaching impact. We know that suicide and suicide attempts cause serious emotional, physical, and economic impacts. People who attempt suicide and survive may experience serious injuries that have long-lasting effects or terms on their health. They may also experience depression and other mental health concerns. The good news is that more than 90% of people who attempt suicide and survive, they never go on to die, right? Due to that. So we want to make sure that also suicide and suicide attempts, they affect the health and the well-being of friends, loved ones, and co-workers. So, and the community. When people die by suicide, their surviving family and friends may experience shock, anger, guilt, symptoms of depression or anxiety, and they may even experience thoughts of suicide themselves. So that's why it's really important that we prevent that, that we're aware so that we can help our loved ones. And then of course, the last one is suicide can be prevented, and everyone has a role to play to save lives and create those healthy and strong individuals, families, and communities. Suicide prevention does require a comprehensive public health approach. So it's really important that we educate ourselves, that we're aware, that we make everyone aware what are some of the signs and symptoms to look for, and really create awareness towards this. So you may ask yourselves, who is at risk for suicide? Is it only a certain population, a certain race, a certain age group? Well, people of all genders, ages, and ethnicities can be at risk for suicide. The main risk factors for suicide, and I'm going to read through some of these bullets, can be a person who has a history of suicide attempts, or someone that has or is experiencing depression or other mental health disorders, or has a substance use disorder, someone that may be in chronic pain, for example, someone that has a family history of mental disorder or substance use, or someone that may have family history of suicide. Another one would be exposure to family violence, including physical or sexual abuse, or anyone that has the presence of guns or other firearms in the home, that they're at risk. Why? Because they have easy access to this. Or someone who has recently just been released from prison or jail, that they may feel that they don't know what to expect once they're out. Perhaps they're going through issues, or they may not even know like they may not even have a plan, and they may be like, okay, so what happens now, right? So, and then just being exposed to either directly or indirectly to others, for example, experiencing others that are experiencing suicidal behavior, such as that of perhaps family members or peers. And then again, social media has a lot to do, right? A lot of influence, especially amongst our young ones. So it's really important that people who have risk factors for suicide, that they are aware, and that we know what some of these risk factors are. It's really important to keep in mind someone who is showing warning signs of suicide, because they may be at higher risk for danger, and they may need immediate help or immediate attention. Stressful life events can also contribute, or those persons can be at have a higher risk factor. For example, someone who has just recently has lost a loved one, or perhaps someone that is having legal troubles or financial difficulties, or it could be interpersonal stressors, someone who has shame, or has been harassed or bullied, or even feels discriminated against, or even has relationship problems, those people may be at higher risk of suicide, especially when they occur along with suicide risk factors. So according to the CDC, which is the Centers for Disease Control and Prevention, women are more likely to attempt suicide than men. But men are more likely to die by suicide than women. And this may be because men are more likely to attempt suicide using very lethal methods, such as using a firearm or suffocation or even hanging. And women, on the other side, they are more likely to attempt suicide, for example, by poisoning or including overdosing on prescribed or unprescribed prescription drugs. However, recent CDC data suggests that the leading means of suicide for women may be shifting toward more lethal methods. So women are now finding ways to attempt suicide, just like men are doing. So it's not only by overdosing on prescription drugs, but it's also on using more lethal methods like men are doing or have done. CDC data also shows that suicide rates vary by race, ethnicity, age, and gender. American Indian and Alaska Native men have the highest rates of suicide, followed by non-Hispanic white males. And although the rate of suicide death among preteens and younger teens is lower than that of older adolescents and adults, it has increased over time. So suicide now ranks as the second leading cause of death for youth ages 10 to 14. And for children under age 12, research indicates that Black children have a higher rate of suicide death than white children. So just something really important to keep an eye out for. Other Americans with higher than average rates of suicide are also veterans, or veteran population. These people, or people that live in rural areas, or workers, right, that work in certain industries, or people that have a certain profession, they're more likely to also have higher rates of suicide. And let's not forget our young people who are in the gay and lesbian and bisexual community also. They may have suicidal ideation as compared to their peers who are identified as straight. So just the pressure that they feel. So it's really important that we keep that in mind. We want to make sure that what are some of the things or some of the warning signs, things that we need to be on the lookout. So we know that suicide is complicated and tragic, right? But it can be preventable. And it's important that we know those warning signs for suicide and how to get help, because it could save lives. It could really help save someone else's lives. So while there is no single cause for suicide, we know that the risk factors and warning signs may increase the likelihood of an attempt. So let's find out. So if a person is talking about it, for example, a person makes a comment about killing themselves, or they're feeling hopeless, they express that there's no reason for me to continue, right? Or if the person expresses or verbalizes that they have no reason to live, or they feel that they're a burden to others, right? Or they feel trapped, or they feel unbearable pain. So these are persons that may probably, if they're expressing this, if they're verbalizing, we want to make sure that we keep an ear out for these kinds of things or expressions or statements that they make. People with some other warning signs may be behavior. It's really important that we keep an eye out for those when a person expresses or we notice a change in their behavior and that they're adopting new behaviors. It's really important that if the person exhibits some of these signs, that we're on the lookout. For example, increased use of alcohol or drugs. If you notice someone that, yes, they use, but you see that it's more than the usual, we want to make sure that we inquire, or that we keep an eye out for this. Or if the person is looking for a way to end their life, such as searching online for methods. Sometimes people go online and they create a plan, right? Those are warning signs. Those are red flags, things that we need to keep an eye out. Or if a person withdraws from activities, all of a sudden we notice that this person is no longer involved or withdraws from a social group, we want to make sure that we keep an eye out for that. Or the person isolates from family and friends, no longer is coming around. If the person sleeps too much or too little. Visiting, if the person is visiting or calling people to say goodbye. Usually when people do that, they're saying their goodbyes. They have a plan. The person may be giving away their prized possessions. They start giving out the things that have the most meaning to them. They give them out to their friends or to family members, right? And then we have aggression and fatigue. The next one is mood. So people who are considering suicide often display one or more of the following moods, such as depression, anxiety, loss of interest, irritability, humiliation or shame. For example, talking about feelings of guilt or shame. Then we have agitation or anger. For example, getting or acting anxious, or relief, sudden improvement. They may also change moods. Let's say, for example, one moment they're very sad, then they go to very calm, and then they go to happy, or it may be vice versa. Or if a person just shows or talks about seeking revenge, right? We want to make sure that we keep an eye out for these warning signs. So many factors contribute to suicide risk. So a combination of situations could lead someone to consider suicide. So risk factors increase the possibility of suicide, but they may not be direct causes. For example, if an individual or some risk factors, if the individual has previously attempted suicide or has a mental illness, social isolation, criminal problems, we have financial problems, impulsive or aggressive tendencies, job problems or even job loss, legal problems, serious illness, or substance use disorder. Then we have relationship. If the child, let's say, for example, if the person had abuse childhood experiences such as child abuse or neglect, bullying, family history of suicide, relationship problems such as breakup or violence or loss, or sexual violence. And we have community. Barriers to healthcare could be a risk. Cultural and religious beliefs, such as the belief that suicide is noble and resolution of a personal problem. Then we have suicide cluster in the community. And then societal, the stigma associated with mental illness or help seeking. Easy access to lethal means among people at risk. For example, like we mentioned earlier, people that have firearms at the home, right? They have easy access to this, or medications. So something that we, that these people or these persons are at higher risk. And then we have unsafe media portrayals of suicide. Social media can also play a big part and is a big factor. So what are some protective factors? We have coping and problem solving skills is really important and something that we want to make sure that we are that we encourage. Then we have cultural and religious beliefs that discourage suicide. Connections to friends, family, and community support. Really important that we surround ourselves by our friends, family, by the community, joining those support groups, surrounding ourselves by friends that are positive, that have a positive mindset, that are going to encourage us and that are going to support us in even our most difficult times. Supportive relationships with care providers. We want to make sure that we reach out to our doctors, that we reach out to the medical community, to the mental health community, where we can really get the help that we need. Availability of physical and mental health care, like I mentioned, stay connected, reach out to the community because there's a lot of help out there. And then limited access to lethal means among people at risk. So suicide can be prevented. There's a lot or some individual characteristics and things that we can do in our communities that may help protect people from suicidal thoughts and behavior. There is not as much research on these protective factors, but just doing what we can to really bring awareness to our community, to our friends, to our family. We really want to make sure that we educate our community and we bring this awareness that is much needed. So suicide prevention strategies. Suicide is a serious public health problem that can have long-lasting effects on individuals, families, and communities. The good news is that suicide is preventable, and preventing suicide requires strategies at all levels of society in our community. And this includes, like I mentioned, prevention and protective strategies, not only for individuals, but for families in our communities. And everyone can help prevent suicide by learning the warning signs, by promoting prevention and resilience, and committing to a social change. So what treatment options and therapies are available? So we know that effective evidence-based interventions are available to help people who are at risk for suicide. And I have some here that are for you also. Some therapies that are available is, for example, we have cognitive behavioral therapy, which is CBT, right? And this is a type of psychotherapy that can help people learn new ways of dealing with stressful experiences. CBT helps people learn to recognize their thought patterns and consider other or alternative actions when thoughts of suicides arise. So it's like thought replacement. Then we have dialectical behavior therapy. And this is a type of psychotherapy that has been shown to reduce suicidal behavior in adolescents. It has also shown to reduce the rate of suicide attempts in adults with borderline personality disorder, a mental illness, which of course we know that has different varying moods, and the person has a self-image, and the behavior results in impulsive actions. So a therapist trained in this can help a person really recognize when their feelings or actions are disruptive or unhealthy, and they can teach the person skills that can help them cope more effectively with upsetting situations. Then we have brief intervention strategies, and research has shown that creating a safety plan or crisis response plan with specific instructions for what to do and how to get help when having thoughts about suicide can really help reduce a person's risk of acting on suicidal thoughts. So that would be brief intervention strategies. So just really having a plan for when those thoughts or that behavior, you notice that. Then we have collaborative care. And collaborative care is a team-based approach to mental health care. A behavioral health care manager will work with the person, their primary health care provider, and mental health specialists to develop a treatment plan. Collaborative care has also been shown to be an effective way to treat depression and reduce suicidal thoughts. So there is help out there, and there is therapies out there that are available. So when you know of someone, encourage them to seek mental health services. It's really important. There's treatment options out there, the therapist, and we're trained to work with them. So the next slide that I have for you is getting help. So what should you do, or if someone you know, or even yourself, if you or someone you know is considering suicide, or if you know someone in a crisis, please get help as soon as possible. I can't really stress how much it is important for you to get help as soon as possible. Family and friends are often the first ones to recognize the warning signs of suicide. And you all can take the first step towards helping a loved one find the mental health treatment that they need. If someone tells you that they are going to hurt themselves or kill themselves, it's really important that you by no means leave them by themselves. Do not leave them alone. Do not promise that you will keep their thoughts a secret. That's a big no-no. You want to make sure that you tell a trusted friend or family member or someone about what this other person is has verbalized or you've seen or you noticed. Get them help right away. Call 911 if there is immediate danger, or go to the nearest emergency room. When you're in a crisis, you can also contact the National Suicide Prevention Lifeline. And I have the number up here. Or you can also text the crisis text line. You can just text hello. And I have the number here, the information for you. Both services are free and they're available 24 hours a day, 7 days a week, and all calls are confidential. If that is something that you yourself may be worried about, please don't. Everything is confidential. We do not disclose anything. The Lifeline really connects people to the nearest crisis center that provides crisis counseling, or they can even do mental health referrals. And also for you, I have here on the slide the Veteran Crisis Line, which connects service members and veterans in crisis, as well as their family members and friends with qualified Department of Veterans Affairs responders through a confidential toll-free hotline, or an online chat, or even text messaging. So please reach out. I have that information for you on the slide. What about social media? This is really important, something that I really want to cover. What if I see suicidal messages on social media, right? And it happens where people will go on Facebook, go on Instagram or any other platform, and they post certain quotes or statements or just words or even pictures, images. It's really important that knowing how to get help when someone posts these messages, it can really help save a life. Some social media messages or sites have a process to get help for the person posting the message. Okay, if you see messages or live streaming content that suggests someone is actively engaging in suicidal behavior, please call 911 or call the National Suicide Prevention Lifeline. Again, like I mentioned, if you know this person, get them immediate help. Please don't wait. It's once we suspect of someone, let's try to get them immediate help. And how can you find help? Well, if you have thoughts of suicide, or you can tell your healthcare provider. Your healthcare provider will listen to you, to your concerns, and can help you figure out the next steps, perhaps make that mental health referral to a mental health professional. Again, I also posted here, you can call the Substance Abuse or Mental Health Services Administration, which is SAMHSA, for treatment referral, and they can find someone in your area where you can get the help that you need. So please, let's not wait. We've gone over some of these, some of the warning signs, some of the treatment options that are out there for you all. So let's be proactive. Let's prevent this. And yes, so I'm gonna open it up for any questions, any comments.
Thank you so much, Melly. Thank you so much for being with us today. We do have a couple of questions. So I'm gonna go ahead at this point and share my screen, and then we'll start with the Q&A session, okay? Perfect. The first question is, how do you recommend talking to someone that is suicidal?
Again, you want to make sure that you encourage the person to seek help. I know that we want to help ourselves sometimes and we want to encourage them, but there's professionals out there that are trained to do this. Yes, we want to support them, we want to help them out, but the best way you can help someone is by taking the first step and reaching out for help, referring them, taking them to get that, seek treatment that they need.
Thank you so much for that, Melissa. And the next question that we have is, what is the youngest victim of suicide, if you happen to know?
I know that while doing this research, I know that they mentioned from 10 on, but now, I mean, really, this was research back from 2019. So I'm sure that those statistics and that age group has really perhaps changed. But I'm sure that with the pandemic and everything that is going on, I'm sure that the numbers are probably, the age levels have probably gone, I don't know, maybe, I don't want to say because I really, while doing my research, but I mean, we do see children as young as, I know that in my practice, we see children that may verbalize, they may not take action, or they may not know how to make that connection of what it really is, like a suicide attempt or suicide. But we have children, and it all goes back to social media. It all really goes back to what the children are watching, what they're being influenced by, not only on their tablets, on their phones, videos, movies. That's why it's really important that we keep an eye out for our children, especially for our young ones, that they can get so easily influenced by what they see on TV, what they see on videos, what they see posted on social media. They're so young that they can't really make the connection or assimilate sometimes the dangers or the severity of it. So as parents, as adults, it's important that we keep an eye out for those things, and that we limit what it is that they're watching, what it is that they're viewing with their peers. Just get involved.
Thank you so much, Melissa. And we do have time for one more question. And the question reads as follows. After a scary and long battle with COVID-19, my spouse has developed depression or a feeling and thoughts of, I don't belong here. I'm worried it could lead to suicidal thoughts. They have been seen by doctors, but dislike how the medications prescribed make them feel. So he do not take them. He never had those feelings before getting COVID. Do you have any tips or recommendations to help my spouse feel worthy and heard?
So thank you for the question. If for any reason, I know that you mentioned medication. One of the things that I always tell parents when that I work with, one of the things that I always say is, not every medication may work for the same for every child, or it's not tailored for every person. It just depends on the individual. If for any reason, mom or whoever asked this question, if you see, that's why it's important that when your child is taking a medication, that you observe him or her to see how it is. Maybe perhaps it is that the medication is too much of a dose, that the dose is too much for your son or for your daughter. Perhaps it's that's just not the medication. The side effects are really affecting them. So it's important that you take note of all these things, that you let your doctor know, and that's why they adjust these medications. Medication by itself is not just going to do. Taking him to a psychotherapist, taking him for mental health counseling, that's really important. It's a combination of two things. And if for some reason one counselor just isn't doing it for your child, you are entitled to change counselors. You can seek somewhere else. You're not bound to that just one counselor. If perhaps you don't like the services that they're offering at that facility, you can go somewhere else. There's so much help out there. There's so many skilled counselors out there that can help with this. And yes, with depression, with COVID-19, we see that depression and anxiety were some of the things that we saw a spike in during COVID. Why? Because our children, they were so used to a certain routine, to a normal lifestyle. And all of a sudden, from one day to the next, everything changed for everyone, right? But our most affected were our children. So keeping your son or daughter active and really just keeping them getting them that treatment that they need is really important. And of course, if you need further information, I can post my email on the chat box and you can reach out. I have pamphlets and also like a list of community resources that I can make available to you all if you need further services or guidance on how to start.
Thank you so much, Melissa. And I do want to remind our employees that are on the call and everybody who is attending actually, because this is open for household members and of course our dependents and spouses. We do have a completely free counseling service as part of the Employee Assistance Program. So Dear Oaks EAP program, it is an external company that provides those counseling services to the county employees completely free. Now, it is 3 sessions per case or per situation. However, you can definitely have many cases open as needed throughout the year. So I do want to make sure that the employees know that they have that benefit. And it's also 24/7, which is one of the things that I really appreciate about our employee assistance program. We can call at any time whenever we need it. And one thing that I did wanted to highlight is also that let's say that you do not necessarily need or do not want to go to the counseling sessions to the 3 counseling sessions. However, at that point, you're feeling sad or you're going through some emotions that you would like to process with someone that is specialized in that. You can definitely make a call and just express that, share that information with them, and they will be able to guide you and support you with them. Everybody who responds to the Employee Assistance Program is a licensed counselor. So the first second that someone picks up that line, it is a licensed counselor and will be able to help you at all times. They do have a booth here on our wellness fair and they also have a presentation on demand. So make sure that you go and take a look at that. Thank you so much for being here, Melissa. I do appreciate your time and thank you so much for providing us this information.
Yes, thank you, everyone.
Thank you, everyone. We do look forward to seeing you in the next 2 presentations and feel free to explore the exhibit hall or visit our lounge room and our lobby. Thank you. Stay healthy and stay safe. Thank you, everybody.